Welcome back. New this morning, some new research and information on Alzheimer's.
Yeah, joining us right now is Jim Herlihy with Colorado Alzheimer's Association. Thank you so much for coming in.
My pleasure.
So you just got back from this research conference in San Diego. You're sharing some new findings. First, talk about the study of processed food and its correlation with dementia.
Yeah, there was a study done of people who consumed more than 20% of their calories in processed foods, and that's ultra-processed means things that are machined. They have sugar, fat, salt, artificial flavors and colors added to them. I mean, frankly, some of our favorite foods.
Yeah.
Ice cream, potato chips, frozen
Soda.
pizza, breakfast cereals. And if that is more than 20% of your calories, they say that that can lead to a 28% faster cognitive decline. Now that's the bad news.
Yeah.
The good news is, and we've been looking for a cure for Alzheimer's for 116 years since it was first diagnosed, this gives us some room to at least give people guidance in how to construct their diets. I mean, you may have to make some changes, and it's not like 20% of your diet is a safety line. 19% doesn't mean you're safe, 21% doesn't mean it's that much worse. But you need to cut back and make more whole foods part of your diet to give yourself that protection against the changes that'll come as we age.
Yeah, the healthier you are, the healthier you are. So
exactly.
So we're also getting some information about COVID-19 and the long-term impacts of COVID, I understand.
Exactly. And what we're finding is that one of the side effects of COVID can be loss of smell. And so what scientists have discovered is that loss of smell, if it lasts longer, is a better indication of long-term cognitive decline than even the severity of the disease. So we're still, I mean, COVID is so new to us that in terms of long-term tracking of this, I think we're going to learn more. But right now, what they're saying is that in terms of diagnosis and maybe prediction of future challenges, that the loss of smell is a significant factor.
Wow.
Another groundbreaking topic is the impact of socioeconomic risks and dementia as well.
Exactly. And as you see, all of these things tie together, because if you grow up in a poorer neighborhood, your family doesn't have the resources, you're crowded together in your home, you may live in a neighborhood that doesn't get as much fresh air, and you may not have the resources in your family to buy whole foods. You may be eating more processed foods, you may be breathing more polluted air. So, I mean, all of these factors come together, and frankly, one of the factors that coincides with that is that many of these people in the lower economic income areas are people of color, blacks and Hispanics, who we already know by statistics, blacks are twice as likely as whites to develop Alzheimer's, and Hispanics are 50% more likely. So all of these factors come together, and it's hard to single out one. But we're finding that if you live in a lower economic area, you are subjected to all these other factors, which includes less access to proper health care.
Yeah. Jim, was there anything at this conference that really surprised you that came out?
Well, what we're really seeing, I think, over time is that Alzheimer's is not one-dimensional, that there's so many factors that feed into it. I mean, we looked at hypertension and pregnancy. We know that women account for 2/3 of all cases of Alzheimer's, and scientists have not really known why. Now this, 1 in 7 pregnancies involves hypertension. So looking at that as an increased risk for future dementia is an important factor, and being able to control that at the time is good not only for the mother but for the child. So I think what we're seeing is that so many of these things are intermeshed, and so we may not have a cure yet. We've still got 6.5 million Americans and 76,000 Coloradans living with an incurable disease. But if we can find ways to help forestall the start of that, we can save a lot of people a lot of anguish and a lot of financial costs too.
Sure. Yeah. Good to know.
Yeah, I had no idea 2/3 are women. That was like a new thing for me. Well, this is very eye-opening, and we appreciate you coming back in after this conference. You were in like a couple weeks ago, and you said that you were going to this, so we were curious what was going to come out of it. And really interesting findings.
Happy to be back.
All right, good to see you. Thanks.